What's up, guys, and welcome to the Clench episode number 8. Run it.
8. Well, guys, today's subject is very interesting because we're going to talk about patients' expectations, which is a huge subject when it's dental related.
Totally.
What does the patient expect? What is he coming for? What does he want? What does he really need? And then we compare it to the dentist expectation, which is maybe a whole other world. Now, this is a super deep subject, and here's part of our experience.
True. I think it's a very important subject for our YouTube viewers. A lot of people look at all our YouTube videos before visiting us. And in these videos, if you go back enough, you'll find a lot of pearls, a lot of information about what you need. There's so many patients, as you know, that visit us from all over the world. We call it #international dentistry. And it's because patients fly to see us. And it's happened before. Let me put the worst case scenario, that the patient flies in from Canada or New York City or somewhere far away, and they realize when they get here that they cannot get the procedure done because, first off, maybe they didn't send us blood work, which we sometimes ask for, x-rays or pictures even of their mouths, so we had an idea of the case. And I think managing patient expectations comes along with a proper understanding of what patients are coming to Mexico for,
Right.
Yeah, what do you think about that?
I think in our side of the world, our type of patient that comes in wants to get things solved quickly.
Yeah.
With a very good quality.
True.
They want to save money, obviously, because they're coming to another country to, look for economy, but they do want good quality. So it's a mixture of those three things, and I think we have achieved a very good level of delivery.
Yeah.
I think we have done a very good job because
Speeding things up, you mean?
But I think it's because of communication.
Yeah.
I think our strong, ¿cómo se dice? No weakness, but the opposite of weakness.
Our strength.
A strength is the communication. I think we spend quite a bit of time talking to the patients on our first visit.
Yeah.
Going over things, maybe showing pictures of other patients, even Google pictures, just to get to a point.
Yeah.
And most of the time, patients are very well informed.
Yeah.
Most of the time, patients just, go and say, yeah, doc, I know that already. And for us, it's like, okay, but do you know this? And we have to kind of go through a checklist of things like, hey, did you know that? Oh, wait, I didn't know that.
Yeah, oftentimes I tell my patients, hey, this type of clinic or my clinic is not the clinic that's going to give those fine print or small print letters in your, where you're like, oh, nobody told me that. And it's like, yeah, look at this tiny letter here that says your warranty is void. Because, we want to make sure we tell patients every single detail before they come. And even so, guys, we still have patients where the communication isn't so proper sometimes because
we're human beings.
Well, not only that.
Beans.
Dr. Day was a human being. So not even that, guys. It's more to me the fact that a lot of patients think teeth are the same. What am I saying with this is not every case is the same.
No.
So here comes, let's say, John, and let's think of another girl's name, Marcy. John and Marcy, Leticia. And John tells Leticia, oh, I got my teeth done in 2 visits. It was great. The experience was awesome. No pain, no nothing. But Leticia doesn't understand that John's teeth didn't need root canals, didn't need bone grafts, didn't need tissue grafts, didn't need, I don't know. Also, she didn't understand that John doesn't have diabetes like she has. John doesn't take medication for bone density stuff. People are different. Medications you take, illnesses that you may have.
I know I have said this before in another video, but every patient is a whole different book. And
Yes.
this was a teacher of ours.
Yeah.
We had a teacher, and he used to say that, he said, every patient is a different book. You're not gonna read the same book.
Yeah.
And for us, when we were students, I remember thinking like, whatever, like, all right, get over it, doc. Let's get me to prep some teeth.
Yeah.
And I started working with patients, and I started realizing, yes, he's so right.
Yeah. We don't learn this in dental school.
There's not a single case that is the same, and the struggles may be different.
Some patients, like, let me just put to show you the difference. Some patients can keep their mouths open. And when I say open, it's like a crocodile.
2, 3, 4 hours.
Yeah, without a problem. Some patients open their mouth for 20 minutes and they're like, I'm tired. And they start wiggling around and they didn't want to get sedated or put to sleep.
My sister.
Some patients are your family, and your family's like, I'll see you tomorrow in the morning, mom. Mom, hey, Aurora, can you check on my mom? Oh, she's a no-show patient. What? She didn't show up, So every patient is different. Every situation's different. Pain tolerance, Some patients don't like shots. Some patients get really nervous at the dentist. Some patients
Some patients require a lot of explaining.
Some patients lied to us and they didn't tell us they were on certain drugs before getting work done. Like, everything is different, guys. We're dealing with humans here, so.
And we're not judging anybody, guys, because we are patients too. So we understand that part,
Yeah.
Just the other day, I went to the heart doctor because I have high cholesterol, guys, okay? I have high cholesterol from eating too much tacos. And I went to the heart doctor and I waited in a chair for like 15, 20 minutes.
Problems of a Mexican dentist.
I was mad already for waiting 20 minutes. And I remember I was telling the lady at the reception, I was like, hey, you know what? I think I'm gonna cancel because I can't be waiting for so long. And she's like, okay. And I'm like, what? I was expecting something like, no, wait, like she was just, okay. And I was like, well, I'll wait around a little bit more, I'll wait around. I mean, it's my heart, but anyways, it's just, I understand the part of being a patient. I understand. I'm a very picky patient too.
Yeah.
And I think when it comes to being a tourist patient, it's someone that is traveling hours to arrive to a place and expect to get something solved.
Yeah.
I would be picky too. So I love it. I always love the challenge of solving different cases, complex cases, so.
Needless, this is to say, guys, as you're watching this, that your case may be different, that you are coming to a medical office, a dental office, where maybe the patient before you was supposed to be 30 minutes and now it took an hour because we had some sort of complication. These things happen, and doesn't matter how good our protocol is for like stopping these things from happening, like all that we can do, sometimes they still happen. And for that, we apologize for the inconvenience, but it is the world of dentistry. And we like to practice what some doctors called slow dentistry, which is, although we're in a fast-paced moving environment of dental tourism, we like to, and we take pride in taking our time to deliver quality work, which is why some clinics, even in Mexico, guys, are more expensive than other clinics. Red alert, guys, red alert. If you're coming to Mexico seeking very cheap dental work, but you want quality, very cheap money-wise, most of the time isn't gonna get you quality. So you're already coming to Mexico, and I've said this before in videos, you're already spending a lot less money. Do not, and this is my personal opinion, because I know I'm not one of the cheapest clinics in my town.
Ask for pictures.
Yeah, don't settle for like,
I think,
well, there's $100 difference. Like that makes sometimes the equipment we use, the materials we use. Materials are the price range in quality materials versus a material that's okay in dentistry. Like even impression materials, I've seen places, and not here in Algodones.
No.
Not here in Algodones, but they use the impression material that we used to use in dental school to learn to deliver veneers. And I'm just like, it's incredible, man. They don't use digital scanners. They don't use top-notch impression materials, you know. And I'm not trying to tell you your dentist sucks. I believe in dental tourism, you know. I think there's a lot of good dentists, but you do have to do your research. Like Dr. Diego said, ask for pictures, you know.
I wanted to say something special. I just had a patient last week that, you know, when she arrived at the consultation, she said, hey, I want some veneers, I want this, I want some crowns changed. And we started working. When I say working, we started talking and about veneers, the difference between veneers and crowns. For her, it was no difference. For me, it's a big difference.
Yeah.
Technically, there's a big difference.
True.
And so she starts showing me pictures on her phone of what she expected. These pictures are of models of teeth that are very well aligned. And, you know, I start pointing out those details to her, you know, hey, you have some missing teeth. You have some teeth right here that are implants. You have some crooked teeth also. I don't think we're gonna be able to achieve that. I think we will get a much better result by changing some of the stuff that is there, but we're not gonna be able to match this, match that, you know, things like that. And she started understanding, and she's like, well, that makes sense. You know, no, I understand that. You know, I just wanted this as an idea. And so I told her, look, I showed her pictures of past cases, and I'm like, look, this is a similar case where we changed some old restorations for veneers. She's like, oh, that looks really good.
Yeah.
And I was like, okay, well, then I think we're getting closer to a result that I can give you with the time frame that I'm given.
Right.
But I'm not like trying to reach her expectation that is over here.
And you know what, Diego, let me interrupt you there. I think if you're watching this and you're a dentist, or if you're watching this and you are a patient, you have to understand both sides of it. As a dentist, we have to reprogram the patient's expectations. They may be wanting to look like, I don't know, what's a pretty girl on TV?
My wife.
Your wife, yeah, or my wife. But like, let's face it, they're way too beautiful.
Way too beautiful for, I can't believe it.
Anyways, let's not get distracted. What I'm saying is, you know, we have to reprogram, and I'm not saying we can't deliver quality, but when things are not proper, like tissue, if the tissue's not right, if the teeth are not aligned properly.
I got an example. My wife actually has really pretty teeth. I'm gonna show a picture of her.
Yeah.
What patients don't know when they see a picture of a model like her is that she went through 6 years of braces.
Yeah.
Gum contouring, gum surgeries, teeth extractions. So she went through a bunch of process, you know, to get to that point. When they arrive here and they want to get this done in a week, for us, it's a huge challenge. Most of the time, we try to push them to say, hey, I think I'm gonna need several visits to achieve something close to that, you know? And again, my goal is to achieve beautiful stuff, guys. Sometimes we even postpone patients, you know, we say, hey, it's not the money, honestly. For us, it's the result. Because we wanna be able to put those trophies up in our wall and say, hey, I did that, you know? I did that. It took us a while, but I'm proud of that work that we did. You know, it's walking around smiling.
So I think bottom line, and we don't want to take this way too far, is when we explain this, when we talk about reprogram our patient expectations, we're not saying like, oh, that's
lower
too
your
much
expectation.
That's too much quality. That's not so good. That's not possible. No, it's just having the patient understand that if you want to get somewhere, we might need a lot more visits, a lot more time, a lot more money. You know, it's like an implant. To make an implant beautiful, a lot of times you need bone graft and you need tissue graft. Can an implant be placed? A lot of surgeons see bone, they place the implant, and that's it. But the restorative work of it, for there to be nice papilla around it and stuff, a lot of times needs either bone grafting or tissue grafting.
Yeah.
Which instead of paying, I don't know, $1,500, $2,000 for your implant, now you're paying $3,000 for your implant. And you could say, well, that's the same price that I would have gotten it somewhere else. Well, not if you consider all the things that you're adding to it. Anyways, guys, that's just
big subject on expectations.
Yeah.
I think it's one of the main subjects in the office.
yeah,
And we always like to get right to it. You know, like every time a patient arrives, it's like, hey, how can I help you?
yeah,
What can I do for you? You know, and the patients are like, I want this done, or you know, I just want to be able to bite. Okay, but what about the aesthetics?
right,
Oh, I want really good aesthetics. Well,
yeah.
hold on, man. Then we got to talk about this.
And I think we can agree to whoever's watching this video, whether you're a patient or not a patient, if you've ever had a bad dental experience, hopefully just not here, somewhere else in the world, you will realize something. If that experience would have been explained to you, if that tooth would have been explained that that's all that they could do for you, you wouldn't, maybe I think 90% of the chances, you wouldn't have been upset. You know, we say in Spanish, sobre aviso no hay engaño.
Yeah.
With a warning, there's not a lie. If I warn you, I'm not lying to you, you know?
Yeah.
And that, at the bottom line of it, at the bottom end of that, is communication.
Yep.
Diego, as always, it has been a pleasure.
Hey, I wanted to
spending
say,
time.
I wanted to include the audience here a little bit.
Yeah.
Who thinks Dr. Nestor should shave? Like, I think it's time. I think it's time for him to shave his beard off.
The mustache?
Why don't we get some votes out there? You know, if we get more than 20 people to say yes, you shave it off.
I haven't agreed to that, but if there's 20 people, you might shake the boat there for me. But
30.
hopefully the people that vote aren't coming to get surgery, because if you are, you might feel a little more than you.
I would
may
shave
desire.
any day, you know.
I'm just kidding.
I look 10 years younger if I shave.
That's also a thing for me though, man. Yeah. Also, guys, guess our ages. For those who don't know how old we are, guess our ages. Comment below your experiences at the dentist. And yeah, much love to you guys.
Wait, one more thing.
What is it?
This is just for fun. If you watch this video this far,
Do not start with the giveaways, Diego.
if you have watched the video to this point, I don't know what minute this is, but tell us the minute where I clap and you get
You're paying for this.
a free freaking implant. Oh, shoot.
All right.
We'll see what happens, guys. Thank you, guys. That was exciting.
By the way, Dr. Diego doesn't place implants,
I
so
don't
if you do
place
get it, he's placing it, not me.
No, you place it, I'll pay for it. I'll see who does it
Love you, man. To infinity
and beyond.
and beyond.